Hi, I am Deborah Ruiz and I will speak about cardiac metastasis in melanoma. About the definition, cardiac metastasis is a late manifestation of this metastasis and can cause arrhythmia, myocardial dysfunction, pericardial effusion, heart failure, or right ventricular obstruction.
Diagnosed with stage 4 metastatic melanoma. Symptoms were a black, purple, ugly nodule on the back of my neck. Where it was there, I covered it up with a Band-Aid and tried to put some stuff on it. I actually just didn't want to accept what it, I didn't know what it was, but I knew it wasn't normal. I went to my family doctor. He took one look at it and he said some words, and I knew it wasn't good. I was at work 7 to 10 days later, and my mom had told me that you got melanoma cancer. I remember my first visit. It was on the ninth floor. It was no longer being used for what it was then. The room was full. I was with my two brothers and my nephew. Very nervous. Got the paperwork done. A lot of paper. Probably spent 3 or 4 hours there, and I was officially registered. I went straight to the oncologist, Dr. Who, surgery on that spot that the doctor cut off. 3 hour surgery. The prognosis was very good. Not in my lymph nodes. Everything was good. Dr. Who put me on a type of called interferon. The interferon, I continued 4 months at home, giving myself a shot 2 days a week. I went 4 months, and then I'll never forget it. It was a Saturday morning. I was on my way to work. I had my jacket in the back, and I put the jacket. I knew what was coming. I put the jacket on my lap, and as I'm going down the freeway, I started throwing up. I had tears. I was very upset, emotionally, as well as sick. And I called my mom. I said, "Mom, I can't do it no more. I can't do it no more interferon. We're done with it." Doctor Who was all for it. He knew I gave it my best shot. Doctor Who was very personal, very knowledgeable. Every time I visited him, we talked about bowling. He always has analogies of what I was going through to like a football game. I remember one time he said, "Tim, we're throwing a Hail Mary," and stuff like that. So I can relate to it. We always hit it all. He's one of my best friends.
In the application in medicine, metastases that cause symptoms but cannot be removed may be treated with radiation, immunotherapy, target therapy, or chemotherapy. The treatment of widespread melanomas has changed in recent years as newer forms of immunotherapy and target drugs have been shown to be more effective than chemotherapy. About pros and cons. As a pro, we have that immunotherapy is a biological therapy that uses the body's natural defense to fight cancer. Substances made by the body or made in a laboratory are used to enlist or restore the immune system that works by destroying cancer cells and thereby stopping the cancer from growing. About the cons, among the cons, we find the side effects of immunotherapy, although immunotherapy is relatively specific because it tends to recognize the abnormal cells of the tumor and not help them. This treatment is not harmless. Sometimes there is a local reaction in the injection area, a febrile illness similar to a flu-like process, but on the other occasions very rare due to the massive release of immunosubstance. A clinical picture that resembles shock can occur, septic with circulatory collapse and organ failure. mainly lungs and kidney, which end up being awful organs and potentially fatal.
Proliferation of pigmented cells, although not always. Melanoma can also originate in different parts of the mucosal tract, including the head and neck, as well as the GI tract, as well as on the bottoms of the palms and soles, which usually doesn't occur in other types of skin cancers. Melanoma is the most deadly form of skin cancer because it is the cancer that is most likely to spread to other organs. Other types of skin cancers rarely spread from outside of the surface of the skin, and the ability of the melanoma to metastasize makes it the most deadly. And the stage 1 melanoma has a cure rate of about 95%. So if you catch it early, that's great. A thicker melanoma, something that is still in the skin but has not spread to the lymph nodes or the rest of the body, still has a pretty high chance of cure if catching it early, somewhere in the range of 70 to 80% chance of cure. Stage 3 melanoma is when the melanoma has escaped from the skin and gone to the lymph nodes. And we divide stage 3 into stage 3A, B, and C, depending on how many lymph nodes are involved. And the cure rate there drops all the way down as low as 20%. Many lymph nodes are involved, and as high as 60 to 70%. Only one lymph node is involved. Stage 4 melanoma is a melanoma that has left the lymph nodes and gone to distant parts of the body. And there, the survival is much less. The overall average median survival is, we're talking in the order of months to maybe a year or so. However, those numbers are getting better with I see melanoma patients usually at two phases. The first phase is if they are diagnosed and they have a lymph node that is positive. Traditionally, the lymph node is removed by the surgeon, and then they come to see me to help them prevent the melanoma from recurring in the rest of their body. And at Mayo Clinic, we have several clinical studies that are geared towards preventing melanoma from spreading to the rest of the body, which we call stage 4 melanoma rather than stage 3. Melanoma does predominantly exist in the older population. However, the amount of number in the younger population is much higher than other types of cancer. We still have a long way to go to eradicate melanoma or completely cure the majority of the patients. But before the last 5 years, we were talking about getting responses and helping maybe 5 to 10% of patients. Now we're moving that bar up to anywhere to 20 to 50% of patients, of causing them long-term remissions, which is a huge step forward, but obviously leaves us with another 50% to improve on as well. So long way to go, but we've come a long way.
About the issue applied in Ecuador, the risk of developing melanoma is associated with ultraviolet radiation, skin color, and geographic location in our country because its location is in the Ecuador. Ultraviolet radiation is high, and it increases even more in high altitude areas. The incidence rates of skin cancer are higher in Ecuadorian highlands such Quito, Cuenca, and Loja, and compared to Guayaquil, Manabí, and El Oro. Among Quito residents, it presents 1.7% of all of cancer diagnoses in the 2011 until 2015 period. 75% occur in people over 47 years of age. Incidence rates increase in men and in women from 2.7 and 2.90x 100,000 in the 5-year period 1986 until 1990 to 4.4 and 3.6 in the 2011 until 2015 period. Quito ranked 40 in men and 41 in women among 69 countries in Sci 5-6. As conclusion, We have when symptomatic cardiac melanoma metastases typically present with shortness of breath and tachycardia with a predilection of the left ventricle and right atrium. Surgical intervention and immunotherapy is currently the mainstay of treatment for the successful management of cardiac melanoma metastases. Thanks.